Hello everyone. A 17-year-old boy who collapsed and died suddenly while doing marathon. Autopsy reveals significant left ventricular hypertrophy. Predominantly, it affects the septum. So there are no valvular abnormalities. His family history is significant that his uncle who died suddenly at the age of 20. Assuming that the patient died of some inherited conditions, what is the likely relevant mutation can be seen in the patient? So options are like dystrophin a cardiac cell cytoskeletal protein, beta myosin heavy chain, a cardiac cell sarcomere protein, mitochondrial enzymes involved in oxidative phosphorylation, fibrillin 1 connective tissue protein mutation, or membrane potassium channel protein mutation. Whenever you have a report of sudden death in young individual, especially like asymptomatic young individual, you need to suspect a case of hypertrophic cardiomyopathy, which is also called HOCM, right? And most often it is familial and it follows the autosomal dominant pattern of inheritance which runs in the family. Almost all cases of hypertrophic cardiomyopathy may have this mutation in cardiac sarcomere proteins, right? So usually when you perform the autopsy of the patient, the dead patient, you may be able to appreciate that the asymmetric hypertrophy of intraventricular septum. So this hypertrophy of septum is predominantly seen in almost majority of the cases of HCM, so the hypertrophic cardiomyopathy, right? So why do we get this hypertrophic cardiomyopathy? It's because of single point missense mutation in genes, right? So and it is running in the family. So what are the mutations? What are the gene mutations can be seen? About 50% of the cases may have this beta myosin heavy chain. So in our case, so it's likely that the beta myosin heavy chain, the cardiac cell sarcomere protein mutation is responsible for the sudden cardiac death presentation in the patient, right? And apart from that, if you have been given with other choices like myosin binding protein C, cardiac troponin T, tropomyosin gene mutations. So their incident reports are around 25, 20 and less than 5%, right? So what happens with these all mutations? So these mutations can cause the myofibril or myocyte structural abnormality. So this creates a deficiency in the fourth generation, right? So that's the presentation of a hypertrophic cardiomyopathy. So likely choice of the given question is beta myosin heavy chain, which is a cardiac cell sarcomere protein. Let's rule out the distractors. So the option A and C, the option A, the dystrophin protein mutation, and option C, the mitochondrial enzymes mutations, which is involved in oxidative phosphorylations, are unlikely can be seen in your hypertrophic cardiomyopathy because these mutations are usually typically seen with your DCM, the dilated cardiomyopathy, whereas the option D, the fibrillin gene mutation, which is usually the connective tissue protein gene mutation, is usually seen with your Marfan syndrome. And again, the membrane potential channel protein mutation, the choice E, is very rare phenomena, and it's about 1 in 5,000 cases may have this congenital QT interval prolongation. So due to the genetic abnormalities in cardiac cell potassium or sodium channels, right? So the relevant mutation still it's your beta myosin heavy chain, which is very common mutation of cardiac cell sarcomere proteins, right? So the take-home message is hypertrophic cardiomyopathy often seen in young athletes, and they do present with sudden cardiac arrest followed by the death, right? So almost all cases of hypertrophic cardiomyopathy follows autosomal dominant mutations, and most commonly it is seen in your beta myosin heavy chain gene, which is responsible for coding the cardiac sarcomere proteins is the problem, right? So whereas the dilated cardiomyopathy on the other side, which is usually seen in one third of patients who presents with cardiomyopathy, right? And again here also it follows the autosomal dominant mutations, and the cases are the genetic cases are like about one third only compared to your hypertrophic cardiomyopathy. Predominantly those are hereditary involvement will be common in hypertrophic cardiomyopathy, right? And in your dilated cardiomyopathy, whenever you have the genetic pattern is there, usually the cardiac myocyte structural proteins are involved instead of cardiac sarcomere proteins in your hypertrophic cardiomyopathy, right? So, and often it is dystrophin gene and mitochondrial enzymes or mutations are involved in your dilated cardiomyopathy. So that concludes the case of a 17-year-old boy who collapsed and died immediately after his marathon activity. Possibly the patient suffering with hypertrophic cardiomyopathy, and the beta myosin heavy chain gene mutation is most likely reason for his death, right? Thank you.